Hi, this is Talia Bennett, Executive Director of HHREC. We have two very special guests today, Angela and Wajia, and they're going to be talking to you about the benefits around telehealth. So we hope you enjoyed this podcast. Thank you for watching.
Hello, my name is Angela Wellman, and I want to welcome you to the HHREC podcast. And I'm here with Wajiha Khan from La Familia Counseling Services. Hello, Wajiha.
Hi, Angela. Thank you for having me here.
Oh, it's wonderful to be here and looking forward to spending the next hour with you, just to learn about your work, and as particularly just looking at what we came here to talk about. And but first, before we do that, could you just kind of give us a little background on who you are and what you do and your claim to fame?
Thanks, Angela. Yes, so I'm a licensed mental health professional. I have a LMFT, licensed marriage family therapist license. And I'm also a senior director for adult outpatient programs at La Familia Counseling Services. And I've been working in the community-based organizations for a while. Most of my work always seems to be in the vicinity of South Alameda County and working with communities that are Medi-Cal members and are looking for support from the nonprofit organizations. I started my journey into mental health counseling in 1998 when I first was a volunteer with the Alameda County Crisis Support Services. And I just loved the work that I was doing along with the other volunteers. We were providing support for the elderly community who were homebound and needed counseling support and resources. And with that, I just pursued my master's in counseling from Cal State Hayward. It was called Cal State Hayward back in the day. Now they changed their name to Cal State East Bay. So, and I just continued my work with different community-based organizations and gained my training hours from different environments like private practice and even universities, as well as school systems. And today I am managing 6 programs that are, primarily, support for adults with severe mental illness.
Mm-hmm. All right. Woo, that's a lot to I'm taking in all that you do, right? And really, honestly, just grateful for what you do. A little bit about me. I'm a musician. I'm a lifelong musician. I'm a music educator, institution builder. I am the founding director of the Oakland Public Conservatory of Music. I've lived an interesting life. Right now I'm really inside of being a scholar. I'm completing my dissertation out of the University of Wisconsin in Madison, which I'm looking forward to. Speaking of mental health, writing a dissertation is it's rough on your mental health.
I'm with you. I'm in that phase too. All about this.
Doing
Yeah,
that too. All right.
I'm doing that too.
You know what I'm talking about then. But I'm in the final stages, and I'm hoping to be finished on my birthday, July the
Yes.
9th, which
Awesome.
is, so, but I guess I want to say before we move on to really talking about, our topic for today, which is telehealth, just to speak about just like mental health and how, I realize I say I'm a musician and that sort of thing, but one of the things I really understand about music, right, is that it's good for your mental health. I mean, singing, humming, listening to music, our bones vibrate when we sing and play an instrument. And music helps keep us, in alignment. So,
I
with
totally
that, I just
agree.
want to put that out there around good mental health, right?
I
So,
completely agree, Angela. And I used music therapy in my sessions when I was a school based clinician. I'm not a certified music therapist, but what I mean is I used music to support the kids that would come in and were unable to identify or express what they were feeling. And I had this little karaoke machine, little very cute portable karaoke machine that I brought to sessions, and kids would love to just come and sing their songs, and even just holding the microphone, it was just really empowering for them
yeah.
to be able to hear their voice amplified, and music was just amazing. It was a great part of my therapy, and was a great part of treatment.
So speaking of treatment,
Yes.
today we came to really talk about telehealth. And so, what is telehealth?
What is telehealth? It's what we're doing now, but we're not providing health services, but we're using a video call. We're using, the electronic resources to connect. And I feel we've been doing this for a while, but telehealth is now becoming an efficient way to reach out to one another, to provide medical and mental health services. And and it's a video call. There's so many platforms now, and Google Hangouts, Zoom, Doxy.me. I mean, the list goes on. Of course, with our smartphones, we have the ability to do FaceTime, but it's a way to connect a provider, whether it be mental health or a medical provider, to a client or a patient, and it has its benefits, and it has its challenges too, which we'll probably talk about later.
And so, how long has telehealth been in existence? Like, when did it start?
Do this is something that had come up earlier, when we had our conversations, but it was just, when we see our doctors, there are always options to choose, maybe a video call or a phone call versus in-person services. And I feel, we've had options for a while to use telehealth, but it was always an option. And because of the pandemic and shelter in place, all of a sudden it was the only way to connect with your provider for a bit,
Right.
right? And so it was no longer an option, but it was like the only way, no choice. That was the only choice we had. And so, telehealth has been around, but I feel now it's becoming more and more common. People are hearing that word a lot, telehealth. They're hearing, Zoom call or video call a lot when they are referring to an appointment with a therapist or a doctor.
Mm-hmm.
So I think it's just a common name now, and a
Yeah,
common mode of therapy.
excuse me. Well, I realized when we were preparing for this, and I'm like, I was telling Phil, I don't know anything about, I don't know what telehealth is. What are you
Yeah,
talking about? And then we start talking, and I'm realizing, wait a minute, I know a lot about
right.
telehealth, enough as a person who used it. So during the pandemic, as you mentioned, I had my regular appointments with my doctor through there. I was having some issues with my hip, and so I did some physical therapy with telehealth. It was like I had a personal, like a one-on-one, and then I also did a group. I'm like, how are we going to do a group? They said you can have a one-on-one, or you can have a group. I'm like, group physical therapy? Okay, I'll give that a go. And so that was very interesting. And yeah, there was one other time that weekly. I see, a therapist, and she uses doxy.me or something like that,
That's it. Yeah.
Doxy, and I see her weekly, and so I'm sort of an expert in telehealth, so to speak.
Right.
And
Right.
how about you? What is your, like, how much do you utilize telehealth? What is your experience with it
Oh,
in your
you
work?
know, in the past year, I would say I wouldn't call myself an expert in Zoom, but I have the ability to, you know, use Zoom like I've never used before. I understand how it works and the ability to like create breakout rooms or different filters and this and that, and just adjusting my mic or adjusting the video options. It's used a lot in my work because as a senior director, I have scheduled different meetings with different program supervisors. Although I don't provide direct services, but I'm helping program supervisors and their staff to connect with their clients and supporting that need. So I use it a lot. I feel it's just the new way right now, and I think it's also very convenient. I can be anywhere and connect to my staff. I can connect as long as I have, Wi-Fi connection. I'm able to connect, and that feels good. That feels like I'm available for my
Mhm.
programs. I feel like, and then that gives them also a peace of mind that if there's anything that comes up and they need to consult, I'm here. I can
Mhm.
connect.
So,
Can't be there in person, but
right. Yeah, that's a whole other thing then, right?
yeah.
But you mentioned earlier, like it has its challenges. So, what are some of those, and how has it then improved since it started, which we've had it for a while?
Right.
What have been some of the challenges and some of the improvements that have been initiated?
I guess the challenge is adjusting to a new system versus seeing someone in person.
Hmm.
As a clinician,
You mean adjusting for the client,
I
or?
think it's both parties, the
Uh-huh.
provider, the therapist, and the clients. And it's not always easy to say, well, I'll see you on video, or I will let me coordinate a Zoom call or a Doxy.me call. These are new terms for lots of our clients in the community who don't have access to a smartphone, who don't have access to a laptop.
Hmm.
So La Familia is able to provide that support for our clients by looking for resources and also looking into grant opportunities to provide the tools that clients need in the community to connect with their case managers and their doctors and their clinicians. Recently, what we did, so that's a challenge right there that clients don't have access.
Hmm.
And to another thing that we've done to reduce that barrier, we have provided just recently, actually, we have set up an area in our office
Hmm.
where clients can come in and utilize a computer, a video camera. We have I think it's a 55-inch screen where they can connect with their clinician, case manager, medical provider to support that connection and the continuity of care during this COVID times. So that's also very supportive for the community that, yeah, if you don't have the access, then we can provide that for you as well.
So a 55-inch screen, that's big. So I mean, what kind of, like, privacy is,
Of course,
I'm just curious about that.
I
If
know,
someone wants to go to La Familia and use the computer,
right?
sitting there with a 55-inch screen, do I have my own
Yeah,
room, or what's
yeah.
going
It's
on?
it's set up in the conference room. Yeah, it's not
Okay.
out in the hallway or anything like that. Yeah.
Wow,
Yeah,
big.
that is a big, yeah, it's a big screen.
Now you could have a group therapy with that,
That's
anyway.
true. That's
With the
true.
good, with
And
the,
and we have that as well because we do community
oh,
out services, and we have a lot of group activities as well that we do on Zoom. So we
yeah.
try where we used to meet up in person, but
hmm
we do that on video calls now.
So seeing the doctors, it's the same, like a medical doctor or mental health professional. It's the same thing as like when we're in person and that sort of thing. Doctors need to write prescriptions, then they just go ahead and put that in the system, and the patient goes and does everything. It seems like so much is in the technology right now. Um, when during the pandemic, did you notice? I know you've said that many people, many of your clients don't have access. But did you notice? I'm curious. An increase, a decrease in like doctors seeing patients, or that sort of thing.
It's kind of like, let's see, um, pre-COVID times, clients would just walk into the office and they would have an appointment. Some don't, and would just walk right in. Unfortunately, we we have to schedule appointments now and make sure that we are utilizing safety protocols in the office. And we don't have the ability to have clients wait in a waiting room like we did before. So, like I said before, there's a lot of adjustment to that. But the appointments are scheduled. There's more structure than before. And we have case managers that can facilitate these appointments. So I wanted to give you an example for one of our programs. We have Service Team, which is a program that supports adults in the community with severe mental illness. And we have a psychiatrist on our team. We have a case manager on our team, and we have a clinician that provides individual therapy as well. So our case managers are their role is so important. They are the liaison to medication management for the client. They are the liaison to individual therapy and to convey symptoms and behaviors to the therapist during our group meetings. And so what they have been doing is if, for example, a client is unable to come into the office for an appointment due to transportation barriers, or they don't have a smartphone, our case managers can utilize their smartphone and connect the client to the therapist or the psychiatrist. And that's that is one of the most important things our case managers do, so that there is continuity of care, and there isn't. There's the ability for the psychiatrist to evaluate a client by a video call, because that's also a very important aspect of medication management.
Yeah. I told you early when we first started, I don't know if I told you this. Yeah. I have a music school that I founded about 16 years ago. And, I mean, when COVID hit, it was like, oh, okay, so how are we going to teach band online? That kind of thing. So we had to really, it was a tremendous pivot. We had to learn a lot. And we were successful in doing that, and we managed to keep the majority of our students engaged and enrolled and that sort of thing. So we had quite a learning curve, and we adjusted, and we had to meet more regularly so we could understand how to do this, and also just understand our own needs, understand the needs of our families, because it wasn't just our students, but it was everyone involved. And so, I mean, while I understand that, La Familia and, the mental health industry has been involved in telehealth for a while, I imagine that we've never been involved in telehealth in a pandemic. So I imagine that there were some adjustments that that had to be made. I mean, I'm imagining. So can you, like, how did your staff and just everyone, the clients, everyone handle the adjustments from in person to telehealth? Was there like, okay, did you,
It was hard.
yeah,
Yeah, I
I'm
mean,
curious about that.
I think, Angela, it's kind of hard. I think, we're just so used to just, okay, I'm going to go see my client. I'm worried about my client. I'm just going to get in my car, drive out, and go to their home. And the things that we used to do just came so naturally because this is how we are used to connecting with our clients. Or yeah, just call them in, to the office. It was just an easier process. Now we have to, like, it's like this pause button. We have to press this pause button. Hold on. Are we utilizing safety protocols? Is it safe to provide services in this manner or not? Was the question of the day, right? Like, is it safe for the client? Is it safe for the clinician? What is the safest way to provide our service? So it was always about, let's continue providing service, but now it was the mode, right? It was the mode of that service. So another example is we used to transport our clients to their doctor's appointments. They need an ID or they need a driver's license. Let's go to DMV together, you know. And so then that also, we had to put a pause on that. But then as we started learning more about, vaccinations and educating our clients and providing vaccination clinics at La Familia, empowering the community to become more and more educated about how we can protect ourselves so we can continue services in the manner that we used to, was also a very important part of adjusting. And so, and that's been very beneficial, and lots of clients of ours have been vaccinated, and clinicians and case managers and providers are vaccinated so they can provide this service as we used to in the past, of course, again, with safety in mind. But some case managers brought their folding chairs, their lawn chairs, and and threw them in the back of their car and went to visit clients and in their front yard or backyard or at a park. Or some clinicians go for a walk. We're outdoors. The space is confidential, where we're not around a lot of public. Let's have a conversation and walk outdoors. So really thinking outside of the box is how we adjusted.
Yeah, I mean, I think we all had to do that. It's like it was a new thing we were new challenge we were confronted with. And I'm pretty amazed at just like humans, our ability to like figure stuff out, and how to survive and even thrive inside of a pandemic. You know, you mentioned the people, right? I'm curious as to like how many, like I'm envisioning all these your therapists and people with their lawn chairs and going to clients' homes,
Right.
and about how many people does La Familia serve, and within this whole pandemic and the telehealth world, as we are, clearly going to a client's house is not telehealth,
That's right.
right?
It's not telehealth.
It's
That's
going there.
right.
And so I'm wondering, given that, did you see the numbers increase or decrease during this time, or where are we now? And about in general,
Right.
then, even outside of the pandemic. So there's two questions here. How was it impacted? Was there more lawn chairs in the front yard during the pandemic? And but just also, that's that question. And
Right.
another question is, in general, how many people would you say utilize um, telehealth, at least in relationship to La Familia and the services that you provide?
I would say, Angela, so, thinking back to March 2019 and just how we had to, let's talk about the anxiety and fear of not knowing what we were capable of doing, not knowing, is this going to be okay, or how long are we going to be shelter in place? And those were the questions that came up quite a bit the earlier part of the pandemic. And then we slowly started to adjust to what we can do and how we can provide our services in a safe manner. But there were a lot of phone calls in the beginning, like if I were to look at like the stages, if there was a timeline and I was looking at the timeline of what we were doing, a lot of phone calls because we're learning about Zoom and what's HIPAA compliant. Like, can we use Google? Can we use FaceTime? And, we're contracted with Alameda County Behavioral Health Care Services. So, of course, we use their guidelines. And there were a lot of unknowns. There were a lot of, let's ask the county, or let's ask quality assurance. And so it was a lot of learning about what programs we could use. And so phone calls to then, Zoom calls or Google FaceTime. And then it was slowly just kind of, okay, how about we do 1 week, we do a phone call and a Zoom call, and then the next week I come out on my lawn chair,
Okay.
let's gradually, because we had to go with the pace of the client's feelings and fears as well, because there was a lot of lack of information. So there was a lot of education that needed to happen in the communities. So La Familia was supporting a lot of communities with classes, town hall meetings, just a lot of information so that the community would feel comfortable and understand and get accurate information from medical professionals. So once that happened, I then again, if you're looking at a timeline, we were seeing clients more in person. So right now, I would say there's a lot of that hybrid telehealth and in-person services going on. Some clients are loving the video calls, and some are not. Some are, I don't want to be on camera, I don't want to do this. So then we have to kind of go at the client's pace and come up with a different mode that's going to be comfortable for the client.
You just kind of accommodate them.
Yes.
You said pick up the phone.
Right. Right.
That's telehealth,
That's telehealth.
right? I mean, I can
Yeah.
imagine that, sometimes you did. I remember when that's what we did. We called our doctor and you could talk to the doctor on the phone. I don't know if there was ever an appointment that I would have. I never have had an appointment with a doctor on the phone, but I imagine that has been the case. I mean, it's not always this technology that we're using right now. It's just
Right.
a basic phone also, right?
Yeah, and what I also like, Angela, is that we're giving our clients options.
Options, yeah.
We're
That's
empowering them to say, you know what, I want to do a video call, or you know what, I want to see you in person. You know what, I can't get out of bed right now. I'm just gonna call you on the phone.
yeah.
And so, we're focusing on how are we going to connect. But we're going to connect with you because we're here to support you. And we're here to tell you that during this pandemic, during this chaos, we're still here. We're still here. But it's how we're going to connect, and we can decide on that together.
So it's kind of like, as I was thinking about how as we were going into this telehealth, this thing, but telehealth is a tool for, you know, connecting with people and being there for them, right? And it's just another way to do really what you seek to do, which is help to heal people and save their lives, so to speak. And telehealth is a robust kind of like platform that we can do that with, right? It's
Yeah,
a tool
definitely. It
to
has
help
allowed
us
us.
really, yeah, it allows us to help heal people and be there for them. And also, you spoke about just the different modalities, and so it does offer more options. I am imagining that, during the pandemic, people were like, "Oh, well, you know what? This is not too bad. I can, I can just roll out of bed, put something on, sit there and talk to my doctor for 50 minutes or whatever. And I haven't had to drive someplace.
Right.
I save time. So how has this impacted, you know, how Familia, if at all, utilizes telehealth? How is it linking with your services now? Have you all opened and made some adjustments and some options for your providers as well? Or previously what everyone was in the office? I'm imagining, I don't know, but is there some are there some shifts happening now as far as
Oh,
you
you
know
mean the staff
how the
coming in?
telehealth? Yeah.
Yeah, yeah. We have amazing admins that are managing these calendars. I don't know how they do it, but we have we're kind of doing like we're staggering staff to come in at certain times and days, so that we don't have a lot of people in the office, and just to maintain safety protocols. Um, and then, of course, managing to meet up with clients as well, but also that has to be very structured so that if we're utilizing, let's say, the conference room or the other two rooms for client therapy, that it's all scheduled. So again,
Mm-hmm.
there's no walk-ins, right? We used to have walk-ins, but we don't have walk-ins clients anymore, and scheduling clients to come in. So that's been very
Mm-hmm.
helpful, and staff as well. Now we are in phase one of coming back to the office, which means we're coming back 1 day a week in the office, and that means in-person services. So we're gradually allowing staff to make those plans to come back to the office, but it's such a gradual process so that it's a very compassionate way to allow staff to make those arrangements, because
Mm-hmm.
again, it's now readjusting to the way it was coming back to the office, from working at home, working remotely all 5 days. Now we're going to come in 1 day a week, and then a couple of months later, it's 3 days a week, and then eventually 5 days a week. So there is a gradual process. So that really helps all of us to adjust to coming back, rather than just like, okay, starting next week, everyone's back 5 days a week. And
Yeah.
it's just not easy that way.
Yeah, that's a lot.
Mm-hmm.
So I realized I was also really also referring more so about the doctors, the providers, the service providers. Are they tending to say, you know what, I think we can do this at home. I don't need to come into the office as much, since because the pandemic showed us, okay, I can stay home and do this. So are there adjustments at La Familia around that, or allowing
Remote
the
services.
therapist,
Yeah.
yeah, to do more at home rather than come in, if clients want to do that? Or one day you're working remotely from home and then another day you work in the office, or those types of adjustments being made?
Yeah. So our medical providers are two psychiatrists that work in our department are providing remote services. They are
Mm-hmm.
providing telehealth services 100% of the time right now, and it's been working out. It has been working out. They have the ability to evaluate clients via video call and connect with their clients. again, the case manager and clinicians are doing most of the in-person direct services. And so our medical providers are very supportive in evaluating clients for medication refills, or, maybe a medication needs to be changed due to, certain symptoms. And they have the ability to evaluate their clients over a
I
video
see.
call.
And so you have a plethora of programs at La Familia. Curious about, out of all the programs you oversee, which programs utilize the telehealth the most?
I would say out of all of our programs, the programs that utilize medication management would be the programs that use telehealth a lot. So we also have a crisis stabilization program. It's a Spanish language access program, and we provide telehealth services as well as in-person support. And with that program, they also have the ability to gain support from a psychiatrist in the program. So, telehealth is being used a lot with that program, as well as service team, which I had mentioned earlier. We have a case manager, a clinician, and a psychiatrist as well for those two programs. So I would say out of all the programs, those two programs use telehealth the most. The other programs in my department, I have reentry treatment team and in-home outreach team. So they do a lot of outreach. They do a lot of driving out into the community and connecting clients to resources. And the first step actually for those two programs is locating the clients, because some are not housed and are moving from different locations. So we first have to locate, engage, and connect to resources. So they're not really using a lot of telehealth for those programs.
Yeah. Woo! I can imagine that during the pandemic, the inability to connect with through telehealth for the unhoused must have been horrendous. I mean, and
Yeah.
you know which of your clients are unhoused, and I hear you saying trying to find them, locate
Yes.
them. What?
That's the whole outreach that we do,
Yeah.
and if we were to even provide provide phones for clients, for example, if you have Medi-Cal, we can go get an Obama phone. We can, and provide that resource. Let's go get a phone. Those phones really don't stay too long with the clients because they're lost or they get stolen. And then, so it's not a real dependable source. So it's, at that point, finding housing, finding opportunities for clients to come to the center is more feasible than providing a phone that's going to be, that's going to be lost. So we look at different options, and yeah, it is a struggle. It is a struggle at times, but once again, if we know where to find certain clients and we get to understand their area of, like, for example, for homeless clients, they usually park their, if they have a car, they park their car in a certain area, or they go to a certain park, or they're in a certain area. So that's helpful to know, and that's where we can provide in-person support.
Well, Wajiha, this has just been so enlightening for me. It's like I'm thinking about a lot of things right now. One is I'm thinking about, the future of telehealth. It's like you spoke about some challenges and some of the disadvantages of telehealth, but so given those challenges and disadvantages, how do you think telehealth can improve in the future? What sort of improvements would you imagine,
I think
if
for the
any?
future, I think in the future, what I see is probably a hybrid of in-person and telehealth happening quite a bit. I think there should be a lot of opportunities to take classes to learn how to utilize a smartphone or a computer, or to the basics of an electronic device. And I think that would be very beneficial, not only for our staff, but for clients, so that they could teach our clients how to use that. And also, I think for community-based organizations to really look at, how we can provide the best, like internet connection has to be, definitely, that's one thing we rely on all the time is just the internet connection. So how can we improve that so that we can connect via telehealth? I mean, we need a good, internet system. So I think just, doing the upgrades and being and trying to be very accurate on all of our systems and our tools would be very, very helpful as well. Once again, back to options, I think clients should be given options to use telehealth if they feel that's going to be the most convenient way to reach out to their provider. I do believe, Angela, that the connection, the dynamic, the energy that's shared between two people in person is invaluable. Nothing replaces that. But seeing your face is really important for me to connect with you, and that would be the next in line. Okay, so in person, then video, then phone. But I will connect in any way possible with my clients, and I just feel this is just these are the times where we have so many options because of technology. But I would always like to encourage clients to think about in-person connections as the most important, most beneficial, most therapeutic. Nothing really compares to that.
Right, exactly. And given that, I mean, we already talked about this some, like some people might prefer it, they just don't want to go and they don't want to drive across town. They don't want to, whatever. They just so, and so they may have changed their minds during the pandemic. I think I just want to continue this, having my mental health meeting with my provider, or my medication management services. I don't really need to come in for that. So do you think that'll continue? Do you think that'll be like become part of like a mainstay, or like there's just that kind of thing? I'm imagining that it was already that way, but I'm just wondering if it'll
Right.
be like something that is encouraged more. You know, um,
I think, for individual therapy, though, Angela, and as a clinician, I once again, I think there's just so much value and so much ther- therapeutic, kind of a therapeutic connection that occurs when you're in person with your therapist. It allows your therapist to really evaluate and to understand what you're needing, what you're saying, and is everything aligned with just like your facial expressions and how you're. I mean, because we constantly do those evaluations. We are constantly assessing for behaviors and symptoms so that we can provide the best support possible. And sometimes over telehealth, you have a video call, then it gets disconnected, or maybe there's background noise and I can't hear what's happening. So those are some of the challenges that occur, and it doesn't give you the most accurate evaluation.
right. Well, earlier you were talking about like how you all are sort of like gradually going back into the office. What is your what is your sense of like when we're going to like return to like life as it was, like pre COVID, like back in the building, and we're coming back and things are just rolling and clipping along as they were before March of 2020. When you have a sense of when you think we'll be back to like that full service regular
Potlucks,
service.
potlucks, and yeah, the weekly
Yeah, potluck.
potlucks.
There you go. Yeah.
Um, yes, and I I'm not sure, and what I think we're aiming for, what we're hoping for, is probably August September timeframe. But
Hmm.
again, La Familia is very connected to just the connected to county CDC guidelines. We're always educating each other. Every week we meet up, and we have an emergency response team meeting every week just to catch up on what's going on in the county. What zone are we in? What's happening with vaccinations? Where are they providing vaccinations? And who's been vaccinated so far? And we're just keeping a tally on so many things. And I also attend a lot of meetings that discuss where we're at, and it feels like we're looking good. I think we're in the orange tier right now,
Hmm.
and I feel this whole coming back to the office is happening. We're like I said, we're in phase 1, and we're hoping for phase 3, which is 5 days a week, to occur in August. So
August.
yeah,
So that's what June, July, 3 months, and everything's back as it was.
and that's
That's
that's the hope,
interesting.
right? Yeah, that's what we're
Because
hoping
we
for.
still have a lot of people who, I don't know, I haven't seen the most recent statistics, but a week ago I saw statistics that 50% of the adults who can be are vaccinated in the country. That leaves a whole lot of people still unvaccinated, and some
Right,
people just don't want to be. So
right,
I'm curious, I'm imagining that the wearing of masks will become permanent, at least quasi permanent, or most of the time, at least. I'm imagining. Are you all having those kinds of conversations?
yeah. We still have our masks, and I think even if you're completely vaccinated, we still are wearing our masks, and that will continue.
I mean, even after into August, and you know
Well, yeah, and it's really hard to determine, is everyone vaccinated or not. I mean, that's sometimes it's information that isn't always readily available. So you may be vaccinated, but then you may also, I mean, you still can get COVID from what I understand. Of course,
Mhm.
I'm not a doctor, but it's good to protect yourself. And so we're definitely using masks, and until further notice. Um, I wanted to actually talk about how our school-based programs are just, I mean, telehealth isn't optimal for our school-based programs because children don't have the attention span to sit in front of a camera for long periods of time. So I'm really excited about the school systems opening up, and so that our clinicians can go to the school site and provide therapy, and provide collaboration with school staff and families. And so I'm really excited about that. Telehealth really, I mean, was challenging because of a younger age group. And so we really had to think outside of the box and take a lot of breaks. But in our school-based programs, we had to put on our creative thinking cap on, and provide entertaining calls for our
Right.
kids that needed
Yeah.
therapy. Yeah,
Yeah.
it was really
You know,
challenging.
we're talking about these. I'm thinking about these people, these masks, and people who are and are not vaccinated. That seems to me to be a place where telehealth really must remain in place, because those of us who are vaccinated, and I'm one of those people, we can still pass the virus, and if we can spread it. And if someone is in the environment who is not vaccinated, then we put others at risk. So I would imagine that there is. Well, I guess my question is there talk around this? Is there conversation about, like, we really need to make sure that our telehealth is robust and as much as possible available to people, because we have to be able to control the spread of the virus still, because there are people who just are not vaccinated, nor are going to be.
Right.
So it how does telehealth and the implementation of, like, more telehealth or not at La Familia and just in the field in general, how does it address that?
I think, just back to what I was saying about having options and going at the client's pace and their comfort level is super important for La Familia staff. It's about providing the service. It's about ensuring that the clients are educated with the resources around them, and connecting them to their medical providers to ask these questions about, the COVID-19 and the symptoms and any fears that they might have. So we're constantly trying to link clients to these resources so that they can function comfortably in the community. So, yeah, and I think clients, will have different viewpoints, different belief systems, different ways of coping. And we're here to go at their pace, at the same time, empower them to make educated choices and beneficial choices for their lives and their families. So I feel it's going to be a combination of phone and video calls and in person and those lawn chairs and whatever it takes to connect with our communities. And when in summer we have we're really we have that on our side, the season and climate that's so perfect for outdoor gatherings and meeting up with the community members. And so I feel that's actually very helpful. So we try to utilize this
I have one
climate.
more question I want to ask
Sure,
you.
sure.
Doctors, take a Hippocratic oath that they're going to be there for people, right? But I can also imagine that many of them did not enjoy telehealth and don't prefer it. And so do you have a sense of, well, that might have shifted, like, oh, you know what, it's not so bad. I think I might want to try this a little bit more, or I hate it. I knew I didn't like it, and now I know I know I don't like it now. So I'm curious as to, like, do you have a sense of, like, whether providers are those people who didn't, are people more comfortable with telehealth now, or I'm talking about the providers, not the clients, right?
Right. I have I have different coworkers that are doing different.
Oh,
Sorry. Did we get disconnected here? I don't know.
yeah, yeah. You froze for a second.
Oh, okay. I was just saying that I think our services are mostly in person, and we are used to that. That's what we do. We meet up with our clients in the community. And that's kind of La Familia's way of really, understanding the dynamics of our community members and evaluating what what support services are best needed. So being in the community. So telehealth is still a new thing, and not everyone is really. Everyone's not high tech. Everyone is not tech savvy, right? Like, so there's a lot of training to be had, but it's an option for them as well. But I do feel that we are really, really, really thankful and grateful about providing in-person services, and the increase that we're seeing in in-person services is really what we're aiming for, because of just the benefits of seeing a client in person. So I think we're really hoping we work more and more towards that goal.
Well, Wajiha, this has truly been the last, 55 minutes of, I've learned a lot and just enjoyed it. I'm going to go away and think about this and how this relates to my own work. So yeah, I thank you. Thank you for coming on to the podcast, and I'm looking forward to hearing more about telehealth in the future.
Thank you so much for having me, Angela. It was wonderful talking with you as well.